they can treat people as human beings, as equals, address, when they're talking to somebody, address the whole package. You know, the idea that somebody is just about mental illness or just about the condition is nonsense. I mean, medication and the illness is only a tiny, tiny % of what needs to be addressed in the individual. Far more important is talking about friends, talking about money, DSS problems, talking about accommodation, and discussing their sense of self and how they're going to cope with life, how they're going to cope with things, how they're going to cope with loneliness, boredom. You know, this is the whole package that needs to be discussed if a professional is going to get through to the individual.
If they speak to the person's doctor regularly, because the person might have some other ill health conditions, asthma, whatever, and find out how that illness might be affecting their mental health issue.
I think that is very important for everybody involved in the process to have an understanding of what is available. So once someone actually approaches you, if you're not able to take on that person on board and to offer the service that you have at the moment, you will be able then to signpost and to refer to a different service, or perhaps to a service that will be offering a different approach, because sometimes it's not what you offer, but it's the way you engage with individuals, for the connection, for the engagement to actually pass the first stage, when people then are engaged and are able to benefit from the activities or for the support or the service.
In terms of the journey, the biggest obstacle is when people present themselves to service, they will say, I've got to tell my story again. And that's the biggest single thing. We did work quite a few years ago on a single point of access, and it was clear then, as now, that the health services have a very, shall we say, in-house idea of how people access services. And this notion of being portable, the idea of your records being available to somebody else, even through, if you move home and change GP service, it can take up to 6 months for those records to be transferred. With an electronic system that's been around for a very, very long time, that's ridiculous.
I think cooperate with each other, and I'm sure they already do as well. And just be working more together and networking a little bit more on behalf of the people that they work for and work with.
They need to be aware of all the other services around in the borough. They need to have some feedback or an interest in them and learn how they operate, how they work, what good comes of them, on an individual one-to-one basis, each service, because each of them is different.
Well, I think with professionals, what I know of them, some of them do ask a lot of questions that might be needed for them, but at the same time, some of them just sort of take it for granted. Not always. With the likes of a GP, I came from A&E where I had a blackout, and I went there because I was told to. And when I went in to see this doctor, I think he was locum, I was trying to explain everything the best that he could understand, and he was writing down, and I wondered what he was doing. He was writing me a prescription, and I'm thinking this is before I finished, because during the night when I was in the Royal London, they gave me something to take. It was like an aspirin, but it was cocodamol that I could take. And of course, I didn't have my reading glasses and the room was dark. So with that, I said I couldn't remember, and he's writing it down for me. And well, to be quite truthful, I more or less told him where to put it, because to me, you're going in to explain to that doctor, and if they're not listening, as I say, or not sort of like giving you the right information, what are you meant to do? Because you go in, you give them the information, you'll come out not knowing anything, or you're better off to go to the chemist and speak to the pharmacy, because they're better and they listen.
I think professionals could take an overview, like a more complete view, and refer you to other services that might be able to help. So to do with your diet, or not just focus on what they're doing, think more broadly.
I think that to see the human being, first of all, behind the problem and behind the allocation of time you have for that individual, having clarity of what is available to be offered to people, I think is fundamental. So you can offer the best possible approach to that individual, trying to provide different solutions, because one thing does not serve everybody. So we have to provide services that are tailored, I think, if we can. So is an effort, and perhaps is necessary to go the extra mile to be able to offer a service that is comprehensive.
Preparedness could be improved. I think secondly, this is something, an idea I've floated several times, is that because of the complexity and variety of services, is that professionals should be better at sharing information.
I think it's very significant that you go to a person that is a little bit more holistic and a little bit more able to comprehend maybe more appropriate service or more appropriate needs. A lot of that has to do with interpersonal skills and how the person is and how they view things.
If the new professional can apologise to start with for not being the old professional, that's a good start, because when faced with a new professional, a new doctor or something, the individual is usually dismayed. What's happened to so-and-so? I knew him. And they're faced with the loss of all those years of knowledge and trust built up with the old doctor or the old health professional.
I think it's being able to talk to each other and obviously to sort of let them know who you are and vice versa. And well, a lot of people like that are in the professional will speak to you and explain what they want or what help they might need.
Coming along to the first session or phoning me up and saying, oh, such and such is like this, how are you feeling about moving to this other professional?
I think that in terms of transitioning from one professional to the other, it's crucial that someone else that is coming to be part of this process is fully engaged with the process.
It might be helpful where there's a named professional, that perhaps someone has given a bit of information about them, who they are, what to expect, their background. That would certainly help. A photograph would help, because often they don't know.
When somebody doesn't understand, that is not helpful. And if somebody doesn't believe you, that is not helpful.
In an ideal world, each health professional or doctor or health professional will have read the case notes of the individual they're about to see. But so often that's not the case, So often they don't have time to do that, or they simply don't, as a matter of policy. They'll get all their information in conversation, and that's hard work for the service user, for the patient. It would help if notes were read beforehand.
In terms of, let's say, specialist professionals, in terms of those at the higher end, they do reasonably well work together. I think when you look at professionals, I don't see there's any reason why you can't call nurses and care workers professionals, because they have a profession that they follow. I've been in hospital several times, and I rarely see a nurse because they're usually around the station ticking into computers. If anything, you see a care worker doing bits and pieces, and they and the nurses don't work well together. There's poor communication between them, and I think that's a very, very bad thing. I think one of the things I've noticed is where one person will say this person needs such and such, and in front of you, somebody else who's not directly involved with your care will gainsay that.
I think it's important for the communication to be clear between these professionals, and it's very important that everyone knows exactly what's their remit into the whole process. So people engaged with the treatment or with the process know who to go for each specific need that they will have, and to look for support accordingly to what people can actually provide in terms of services and the professionals involved. Yeah.
I think if the service user is given full information on the new service, where to go, what to do, who to see, what time, and directions, full directions, because going to a new place is stressful.
All the people working with me know everything, so no sudden changes or surprises.
I think it'd be better, if services could sort of like meet, other people be aware of, what services are out there, and, have regular meetings, maybe, and get together, just so that everybody knows there are lots of services in Tower Hamlets, and it's about knowing the right services that are out there.
People bring different skills to the table, and if the team is working in unison, if they know each other, I think first of all, the professionals, they know, how they are approaching services and people's treatment, and I think then it's for the benefit of the patients and the members using the services that you'll have people with more skills perhaps that will bring a different set of skills and ways of approaching. And perhaps this allows the process to be more creative.
Well, it's good that if you've got the resources of two different people, and maybe they cover different areas, so one person can do this for you and that for you, which is helpful, and another person can do this or that for you from different areas.
Again, communication between those organisations, and where there is communication, the time delay. So I don't see there's going to be necessarily a whole lot of conflict. I think it's more in a case where one service refers you to another, that there's that lag of communication.
I think the nature of the help gets diluted. I think what's important is if a service user finds someone or some people they can get on with. Because if you find someone you can get on with, then you can talk to them about anything. And that's what's really important.
I needed help talking to somebody about a problem that I had. And when I came out of that problem, there was there was a group of people that were like myself all together and laughing and joking, and it felt reassuring that you weren't just there to be seen and leave, that you got talking and you felt part of a family.
What doesn't work is if they're quite far from each other. I think people have to take into consideration mobility and things like that. And actually, like if I'm getting referred to somewhere else, actually somebody asking me, how are you going to get there? How's it going to be easy journey or difficult?
I think there is a need for the person to be able to identify a main service. That is the service this person will relate in case he needs support in case of crisis or for a specific referral that might be coming up because of specific reasons or issues. So then there is the need for a kind of key service or key service worker or a therapist or that will be able to have that responsibility.
Well, it would be nice to know that they're actually talking to each other about maybe a problem that whether you have or someone else might have, that you feel that they're actually doing something.
There is a lot good in Tower Hamlets in terms of mental health service, and I just perhaps needs a little bit more sort of like tweaking and bringing together, and people knowing what's more out there. There is in the voluntary sector there is quite a big link in terms of people networking and getting together and having meetings on a regular basis, and that works well because everybody gets to know what everybody else is doing and what service is appropriate and what's going to be right for people.
There needs to be a discharge package, something like a discharge package for people being discharged from hospital, which can specify places to go, drop-in centres, or other places to go where with groups where they can where time can be spent with other people who understand your situation.
GPs are very, very sort of like push for time, and again, I think if they could have some time away from the GP surgery and perhaps, you know, a little bit time in the community to link in and network with people. They have time restrictions, I'm sure of it, and sort of like, you know, limitations because there's so many people that they have to see. But I think, you know, it'd be good quality sort of like time spent away from the surgery and into the community a little bit more, and then also, you know, see a broader picture.
Signposting is speaking to somebody and telling them where they go from here, which is just, it always seems to be a case of just telling somebody like, we can't help you, you have to go here or you have to go there. And people can be sent around different places all the time.
I think what perhaps would be useful is to map out, actually, to have some sort of mapping out of the services that are coming through the door every time there is a networking, to perhaps put together a document that could become an online platform for people to actually navigate the system. But it would be very nice if there was a mapping of all that is available that was able to be put online. So people could self-refer as well, because it becomes something that is in a level that is not accessible for the members of the public. And I'm sure that people knowing the services, they would be able to then go straight and access services available. Majority of the provisions are open for self-referral, and that would be something very useful, I think, for the residents of the borough, to be able to actually know, instead of having to come across an information that sometimes is just a coincidence that something pops up.
If the GP is more familiar with what's out there, then they can more link in to that person rather than leaving it to the social prescriber, which may not be the same. If you go from one service to another and you opt out of one, you don't get back into the service. There's a lot of complications in relation to that.
They need to be a poster of sorts to let people know, but in a public place, that everybody pass. It could be the likes of the Idea Stall, even the A&E, but public places that everyone could see.
Timetables, there should be a slot where this is for all of us to meet up, and we're going to, actual time allocated for that, for meeting all the people, all the other professionals, to update each other and think about and evaluate what's been done and how it could be done differently.
Perhaps work in connection with health professionals, as psychologists, psychiatrists, psychotherapists, and everybody else involved in treatment and recovery, to perhaps follow up the referrals for a while, to know what's going on and to have some kind of connection still with the case that is referred further on to other services, because it tends to be the one professional that individuals will come back to, or on and often again when something else comes up, or if a crisis period starts. Maybe the professionals need to work alongside for a little longer than just passing the cases and referring and having that transition period. Perhaps the transition needs to be longer, so people can have a proper sense of the GP being aware of.
GPs do tend to be kind of like stuck in the room and the patients come to them, maybe a little bit different, thinking that patients go out a little bit into the GPs go out a little bit into the community and see a little bit more about what's there and what's available, because it's usually other, like the navigators, the social prescribers, or the care coordinators that are in the GP surgeries that do the outlinks and the outreach, whereas the GPs don't do that, and they're the main people that actually seen the people and that have the better understanding and also have a history of what's required and needs.
I think GPs should just ask like what sort of things have you tried, what, yeah, like talk to me and ask, oh, when you went to so and so, how was that? There's also this other place, how was that? Yeah, just talk to the patient more.